Welcome to Real Talk with Pam, where authenticity meets conversation. Today, we're going to be talking about menopause revisited. I have two incredible women with me who are doing amazing things in their community to increase the knowledge and information about menopause. I have Mrs Dosumu, she's a pharmacist, as well as a woman who has written a book called Menopause Unfiltered and runs a community called the Menopause Initiative. I also have a friend of the house, Dr. Simi Alabi. She's a family physician. She is a woman who deals with women on wellness issues and also an author who has just written a book about menopause for women in Nigeria. So let's get started. Ladies, welcome.
Thank you for nice being here.
Fantastic. As you said, you said menopause is real. Indeed, it is. Okay. I am so passionate about this topic because I think that for women, especially, this is a really life-changing time of their lives that can be a very challenging moment for them, or it can go on for years. For example, someone like me, I'm in perimenopause, and I started when I was 49. Now I'm 53, and I go through a plethora of different symptoms. But I know that there are women like yourself, Masu, who you'll share in a minute, who have gone through really challenging, like almost suicidal symptoms when you had menopause. And I think sometimes we can trivialize it for lack of information and say, oh, menopause is just about the hot flushes. But there are women who, and I know Dr. Simi will talk about this later, who actually can be suicidal through this time of their life. So I want you to share with us, what was your experience of menopause that led you to become a passionate advocate for it?
Okay, thank you very much, Pam. 13 years ago, no, let me take it back. When I started my practice as a community pharmacist, I remember that maybe like 23 or 25 years ago. I remember a woman walked into my pharmacy and she told me that when she was 49, she had to remove her womb.
Wow.
And anytime her husband made passes on her, she felt like stabbing the man. And I didn't know anything about it. So I told her to go to psychiatric hospital, not knowing that 10 years down the line, I was going to start mine. You see, while growing up, nobody told me about menopause. Even as a pharmacist, I didn't know anything. When we're born, we go through school, our parents want us to be successful. Nobody tells us or prepares us for when our body starts to change. So when I was 42, that was when my journey started. I have two fantastic boys, Richard and Ronald. And I just noticed that I became very moody. And my second son looked so much like me. And I used to take delight in beating him. I used to be on heels. So anytime I come home, I'll just remove for no reason. I did that for like a year.
Wow.
And then one day I got home and I did exactly the same thing. And then my son was 9 years old then. So he came to my room and he said, he didn't even knock. After I'd beaten him, he came to my room and he said, my mom, you need help.
Wow.
He was 9 years old then. And I thought to myself, a 9-year-old boy coming to tell a 42-year-old woman she needs help. And then I started hearing voices. And something kept telling me depression. I didn't even know what depression was. So I brought up my laptop and I Googled the meaning of depression, the signs and symptoms of depression. And out of 15 signs and symptoms, I was going through 13. So I went through that for like 2 years. And I had 5 branches of pharmacy then. I had brain fog. I went through depression. I couldn't manage anything, so I lost my businesses. So I had to start all over again. When I'm driving on Third Mainland Bridge, I will hear voices telling me, park your car and jump in there. Or when I'm in the kitchen, I'll hear voices telling me, take that knife and stab yourself. But you see, that happens to most women. And some women have lost their lives through that. But for 2 years, I didn't go to work. What was I doing? This is very practical of Nigerian women. We are very religious. We love God. all I was doing was reading my Bible and praying.
Right.
I stopped going to church because I thought my pastor wasn't making sense. I started going from one church to another until when my boys told me, "No, mom, something is wrong somewhere. You need help." I remember one day I was changing and I felt something. Maybe Dr. Simi will be able to explain that. I felt something leap within my stomach. And I thought to myself, this is stomach cancer. But you see, while my body system was changing, I didn't go to the hospital. I didn't even know I was going through body change, perimenopause. I didn't nobody to talk to. And I thought I had stomach cancer. And as usual, I put myself on some medication. And I thought, this is what women do. So I thought to myself, let me change my diet. When I eat, it wasn't digesting. So all I was eating was pap and women. And then I started walking. That walking made a lot of difference. And then I lost a lot of weight. So my digestive system was better. And then one day, I'm a very skin freak person. I woke up with a keratinized dry skin, very itchy. And I busted into tears and I said, God, you just have to help me here. And I went back. My laptop was my best friend for 2 years. 2 years I wasn't going to work. And then I opened my system and I typed keratinized and dry, scaly skin. And lo and behold, I saw it. One of the signs and symptoms of menopause. I was really very happy because I thought I was dying. I thought that was the end of my life. I didn't have a hand to hold. So, and then at that time I was doing my master's. I ended up not finishing my master's because I had, when you say terrible, I had brain lapses. I had, I couldn't just remember anything. 6 months down the line, I had to walk away from it because I could read a topic 50 times. And I just told myself, let me say it in Yoruba, wow. So I walked away. So I didn't finish, but I didn't know it was brain lapses. I thought maybe some people from my daddy's village,
Your village people,
my village
right?
people were running after me. And after 2 years, I started getting better. And then, people don't go to the hospital. They come to the pharmacy. I remember the first lady that came to meet me in the pharmacy, she had gone to 3 hospitals and then she needed help. I listened to her and I told her, this was what I went through. This was what I went through. Advised her and she said, no, at 45, why would she be going through menopause? So I made her understand that there are 3 different stages. You have perimenopause, you have menopause, and you have post-menopause. But she still didn't believe. She was dying, her husband. Things were just not working for her. So after advising her, I put her on some supplements and it worked. So she believed she was going through menopause. Then there was another lady. She was a pastor's wife in Ilori. And then she had this for 2 years. She stopped working. She had a house girl that people said was the one bewitching her in quote. And the house girl had been with her for like 15 years. So she sent the girl away, hoping that those signs and symptoms would be better.
Right.
Unfortunately for her,
They continue.
they got aggravated because because of stress. So she found me on Facebook and I was also able to help her. So today, those 2 women, now on Facebook, we have over 6,000 women.
Wow.
And men. So we don't talk to women alone. We talk to both women and men. And on Facebook, we have almost 60,000 followers. So I can't imagine. I can't imagine seeing people going through what I went through. So I just decided that let me provide that help that people are looking for.
That's fantastic. Amazing, amazing.
Thank
Well
you very
done.
much.
Well
Thank
done.
you. Thank
Well
you.
done. I wanted to ask Dr. Simi, because you've heard her story. Why is it that there is still stigma about this whole thing, about menopause? Obviously, you've trained abroad and you worked abroad and now you're back here. What has been your experience working in Nigeria and dealing with menopause issues with women?
I mean, it's massive, and your story is really compelling. So, I mean, very well done what you did. I mean, the UK was a journey, wasn't it? Initially 10 years ago, people were doing the same thing. no one knew what menopause was. And it took advocacy from celebrities to really bring it to the forefront, to the place where we are now, where women don't have to pay for HRT if they choose to take HRT. Coming back to Nigeria, I mean, I knew it was going to be totally different, but I wasn't prepared for how different it was going to be. So from the level of just even the access to knowledge, where the women don't know that they're going through menopause, right? And then to the level of then stigmatization of I'm losing my youth and I'm losing my beauty and I'm not quite the way I was before. And then to lack of support within the family. You know, your husband, your children think, what is wrong with you? You know, what's wrong with this person? Now patients who will say they avoid me because I'm so snappy, so irritable, always angry, that kind of thing. So it's and then to the point where there's no access to HRTs. If you decide to have HRT, then there's minimal access. But there's a whole lot of things that you can do before getting to the point of HRT. But if it's going to cause catastrophic life changes, where your life really is stopped or stunted, then I would definitely advocate for that. And then we should have access to that. There really isn't access to that. As I said before, there's one company, which I'm really, really surprised they provide it for their staff if they do need it. But coming home, and for me, that was why I decided 4 months down the line, I was going to publish a book on it. An ebook, because I felt we need simple, actionable information about what age of menopause is and how to deal with it with lifestyle changes.
What has been the most surprising, maybe, case that you've seen?
Or if I mean, even
without mentioning any names,
no,
yeah.
Yes, patient confidentiality
Yes, of
is super
course.
important. But I've seen so many women, you know, and I think one of the most surprising ones I would say is when a lady I saw not too long ago, and she had this severe life changes. A very supportive husband, but it was so catastrophic because she lost weight, she became very depressed, lost motivation completely, and was becoming suicidal. So I was thinking, what's the point of it all? Why am I like this? And trying to explain to her that while we might have an overlap between clinical depression that is unrelated to menopause and menopause, many times the menopause itself is a trigger for the clinical depression. And that was really beyond, she just couldn't wrap her head around it. So that was a difficult one to deal with. And I think there's so many others. I mean, there's so many cases. And I think one was saying to me that she just can't even work. And most of these women are senior executives at work because at that phase of life, you are at the pinnacle of your career.
Yes.
And your late 40s, early 50s, you are VP, CEO, everybody's looking up to you and you're like, I can't even think. I don't even remember what you said just now. And who do you tell? So that advocacy bit needs to be there, particularly for government, for offices, for private sector, really talking about this. It's a fantastic phase of life because you will become post-menopausal one day.
Right.
And these symptoms will go away, although there's some symptoms that will not go away.
Like what?
Atrophic vaginitis, for instance. So being dry down below.
Okay.
Because that affects your libido and your sex life. And that is important. There's no reason why you shouldn't have a thriving sex life till the end of your life. There's no reason why. So, and that does not get better. And there are other risks that are in the background that are just there that you have to actively do something about.
Right. Well, we'll talk about more of that later. Amazing. So I wanted to go back to you, Mosun. I know that your story led you to, like you said, create a community which you have 60,000 followers. You have an initiative called the Menopause Initiative.
Menopause Support Initiative.
Right, Menopause Support Initiative. Can you tell us some of what that does? It's exciting to know that there is a community that helps people in Nigeria, and what that does. What are some of the services that you provide?
Okay, sometime last year, we decided to bring together the stories of women in the club, and that led to this. We have stories of women in the club, and it's called Menopause Unfiltered. And we have this advocacy group. It's called I Walk for Menopause, where we get the government attention, we get support from companies, and especially some of these companies that market supplements, nutraceuticals, and that has been found to be very effective, where those people come together and we showcase that to the community. Last year we had over 1,500 men and women come together, and we had a 10-kilometer walk was huge, was beautiful. And then we had people share their stories. And another service that we just started is called the Vital Plus. We partnered with Beacon Health Diagnostics. Beacon Health Diagnostics has over 20 centers, diagnostic centers, all over the country. And because our members are all over the country, so we encourage them to get involved in preventive health and check your system. Anywhere you are in Nigeria, just walk into any Beacon Health Diagnostic Center. What the tests that they normally do for 250,000 naira, they do it for us for 85,000 naira. And we also have what we call Step and Share. This is, we encourage our members. I discovered that most women are very lazy. They want what I call the miracle thing. They don't want to do anything, and they're still struggling with those signs and symptoms. And well, Dr. Simi has encouraged me and taught me a lot about the HRT. But before the HRT thing, there's something you can get involved in your lifestyle change. So the Step and Share Club, we encourage them to join. We use an app, and everybody in the community come together to walk a minimum of 10 kilometers every day. And we also have what I call Meno Talk. Some people want personalized services. They just want you to come and listen to them.
Right.
So we have those services, both virtual and the physical one. You come to me, we book an appointment. I just sit down and I listen to you. If I had that, maybe when I was going through mine and there was Dr. Simi, I don't think I would have lost my businesses.
Right. Yes.
So those are the services that we engage in. And also we have the Ask Me. It's called Ask Me Anything on Menopause. So this is once in a month. We gather everybody together. Ask me any question on menopause. So we can bring Dr. Simi on to come and talk to our members. And we just want to educate people. We want people to be aware that right now there's help. I'm glad at what Dr. Simi is doing. We can partner together.
Absolutely.
And save the 75% of Nigerians above the age of 45. And get everybody well knowledgeable about menopause. And then people think that menopause is a form of sickness or disease. No, I'm enjoying the best of my life now. Menopause is so sweet. When you have knowledge,
yes,
you can actually live above it.
Amazing. That's fantastic. I love that. So, Dr. Simi, you just wrote a book. I'm really excited because you told me when it was in the process, and congratulations that it's out. It's called Menopause for the Nigerian Woman.
Menopause Manual for the Nigerian Woman.
Tell us a sneak peek about that. I'm downloading mine later on tonight.
Thank you. So it was after our first show on menopause, and I'd been seeing patients at that time. When we had our last talk, it was about 6 weeks after I'd arrived in Nigeria. Oh my God, I was in awe as to what was going on. And then we had that discussion, and I thought, let me just put these thoughts in an e-manual or an e-book. Although people are asking for us to publish it now, an e-book that people can see very simple, jargon-free information about what they're going through, you know, and then all the things to do, you know, in chapters. What do you do about your emotional and mental health? What do you do about weight gain? What do you do about hot flushes? You know, specific stuff. And so that was released 2 days ago.
Right.
And it's amazing because we've already had our first downloads, which is really good. And it's just really for everyone. And I think even men should get it.
Right.
Because it would really save your relationships. You know, as I said earlier, I'd seen a patient with the husband, and the husband was complaining about his wife who was 55. And I said, have you asked her about the menopause? And she was rolling her eyes and, you know, really irritated. And he really wanted to know. It was I really want to know. So men should also, you know, download the book and really understand what their partners are going through.
Sure.
And obviously, women, we owe it to ourselves to learn, because we learned about menarche, we learned about menstruation in school. But it's interesting that they didn't teach about menopause in school. And I wonder why.
Yeah, yeah. Amazing. So we'll just take a quick break right now. We'll come back and continue this amazing conversation. Welcome back to Real Talk with Pam. We've been taking a deep dive today into Menopause Revisited, and we've been talking to Mosu and Dr. Simi about the wonderful work they're doing to increase knowledge about the menopause. So ladies, let's continue. Mosu, I wanted to ask you, so after all these years of trying to really encourage people and the wonderful work that you're doing, what has been the biggest misconception that you still think people have about menopause?
Okay, personally, from me, because that was one of those things that affected me, people believe that menopause starts at 50.
Right.
Menopause doesn't start at 50. The moment your body starts to change, that's perimenopause. So perimenopause starts much earlier than 50. And because you see people lack knowledge, they wait until they're 50, 51, and they start looking for the signs and symptoms of menopause. And that's why we need to keep educating and talking about it. The second one, people believe that menopause is peculiar to only women. No.
Right.
Menopause simply means systematic body change. Men also go through menopause when it's called andropause. So when you start talking to women and then you mistakenly mention that men go through menopause, they say, oh no, men don't go through menopause. Men also go through menopause. And another one that I came across was when, that was really very shocking for me. When I went to Ikorodu, and I had to speak to a group of men and women Muslims, and the men actually came up and they told me that once their wives are 50, they don't have their regular periods. They don't, how do I put it now? They don't make love to them.
Right.
Because they believe that once they make love to them, they contact a form of disease. Well, over time, I've gotten to understand that during this time, that's the period you enjoy sex most.
Right.
And then another one is some people believe that menopause is a form of sickness or disease. Menopause is not a form of sickness or disease. It's just a misconception. Because once you have knowledge about your body system changing, you are armed. And then you will be able to live above those signs and symptoms. And the menopause is it's just a part of life. It is normal and it is real. And then some women believe that once I get to menopause, that's the end of my life.
Right.
At menopause, that's the stage when you start to live. It might be the end of your reproductive life, but it is the beginning of good life for every woman.
Fantastic.
So at 50, you can thrive.
Awesome.
At 50, you can have dreams and live your dream.
Great. You're an example? Yes. That's great. I'm an example?
Yes, I'm enjoying my life.
Great. So Dr. Simi, what has been the earliest in your many years of experience of talking to women, the earliest patient you have seen that has encountered menopause?
Well, that's an interesting question. We don't call it menopause
Okay.
below 40.
All right.
So there are women who their ovaries fail at 18, 19, 20, 30, or any ovarian failure, any stoppage of your periods below 40, we have to investigate it. So we don't call it menopause, even though it is technically the menopause, but it has to be investigated because it's not what is usual. And I have seen many women under 40 suddenly have what we call premature ovarian failure.
Right.
And usually that needs to be seen by a specialist, a gynecologist, to find out why has it happened. Now, what do we do about it? You can imagine somebody living in a state of estrogen deficiency from age of 18. Their bones will be almost gone by the time they are 40.
Right.
So they need to be looked after.
Right.
And then other issues can cause it. Genetic issues can cause that.
Right.
But after 40, it can happen at any time.
Anytime. But what about maybe a woman who's 35, for instance, has had a child, and then after that stops her period?
Still premature.
Is that still premature?
Because you're under 40 years old.
Right.
We don't expect it before then. So it has to be, we have to just investigate it, be sure there's nothing else going on, and then treat it if needed.
Okay, I also want you to talk about, for women who have gone through the menopause or are in the thick of perimenopause, what are some of the risk factors that we should be looking out for? Because I know someone like me, I'm like, let's just enough already, just go, come and go, so I can stop having a period. You know what I mean? So I'm that in that phase where it's not completely gone, but it's kind of erratic and comes every 6 months. And I'm like, just go already, please. And then I think I'm going to be free. But you have to think about, there are risk factors after menopause. What are some of those that we should really be particular about?
So any bleeding at all that is not a cycle, you should speak to somebody about at whatever age. Then it becomes more concerning during the menopause or perimenopause and after. I think at the perimenopause you become quite confused because you don't know whether this is just a cycle that's just come out of nowhere after 3 months or whether this is bleeding that is dangerous. So you should be keeping a period diary. I tell every woman to keep a bleeding diary because there's usually a pattern for an abnormal bleed. So for instance, if you have intercourse and you bleed, we see that as an abnormal bleed and we really have to check your cervix and we have to check your endometrium, the lining of your womb as well. So every woman should be having regular cervical smears. Be sure that there's no cervical cancer going on. And if there's any bleeding post-menopause, we will check for endometrial cancer.
Right.
So for me, it's really being careful and looking at your diary, keeping that diary. And if the period, the bleeding is out of whack, then you really should be speaking to somebody, even if you think it's just perimenopausal bleeding. Because during the perimenopause as well, some women have very heavy bleeding. And they're like, oh, it's perimenopause. Well, it could be a fibroid, it could be something else as well. So your doctor is your friend. Your GP is your friend.
Right.
And what I find is that people generally don't want to talk to the doctor first.
Right.
But actually, your primary care physician should be your first port of call.
They'll go to their pastors first. Right.
Go to the pastors, go to the patent medicine sellers, and go to the pharmacy, which I think is really good. And I think one of the things I've seen about the UK and Nigeria is that pharmacists upskill and they're able to carry out mini consultations. And it's be formalized in the UK. I would really like that to be formalized here in Nigeria, where we know what we're going to the pharmacist for in terms of consultations, rather than just go and stress the pharmacist for nothing. Do you understand? So I think they're useful, but really your primary care physician is really your friend, and you should have one.
Right.
You should have one that knows you, that knows your notes, that can put things together. You know, I find that people go to one doctor for their hypertension, one for the diabetes, one for this. Actually, you need one doctor holding all that information.
Right.
And that person is a primary care specialist that you use.
I have a question for Dr. Simi.
Please go ahead.
How come doctors don't know about menopause?
Oh.
Because most of the time, even when these people go to doctors, it takes them a very long time. They don't even get to know. So how do we handle this?
So I think that's been frustrating for me as well, because they've come to me and said, I've been everywhere. Doctor said, don't worry, it's just this, right? So we also, not just about going to just your doctor, but going to a doctor that has skill in women's health. So for me, I'm a primary care specialist with a special interest in women's health. And there are a few of us like that around the area, because really for something like menopause, you don't need to go and see a gynecologist for that. It's absolutely unnecessary. So that's another thing we can do, actually formalize who are the primary care specialists that understand about menopause and how do we see them, both publicly and privately, not just private doctors. But even for Lagos State is doing a lot on women's health. You know, and seeing which, PHC do I go to, primary healthcare center, can I go and get help? That's so important, because many women don't have health insurance, or you don't have, and we need to have health insurance, by the way. Health insurance is healthcare financing. Menopause is not cheap. You're going to buy medication, if you're going to do it, it costs money.
Right.
So there's a whole advocacy issue that we need to tackle around even the access to those doctors that understand about women's health and also accessing that
we see in this part of the world, we don't know the difference. So I think we need to talk a lot about that.
Yes.
And that's why we're here doing
and
this.
Lagos State is doing a lot on primary healthcare and trying to make sure that we talk more about it. So there's more to be said.
More to be said.
Discussion.
Yes. And I know that Mostly you do a conference every year. Could you tell us about
The
that?
conference is called I Work for Menopause. It's an advocacy program. We partner with, last year we partnered with Lagos State, and we do it every year. October 18th is World Menopause Day. So it's a way of celebrating World Menopause Day in Nigeria. And we gather people together. Everybody in our community comes together. We will invite Dr. Simi this year. We'll invite you. We'll get experts to talk to the community, talk to the world, and then we'll do a lot of publicity. We share experiences. We network. So it's getting bigger every day.
Fantastic, amazing.
So we're looking forward to this year, October 18th, and we're going to get more people involved.
Fantastic, great. So just final thoughts about the menopause, about how women can come together as a community. I'd like you guys to look into the camera and just say some final thoughts on that.
Let Dr. Simi go first.
You know, I think the biggest thing for me is that as a woman, you're worth it. And I've noticed that women don't put themselves first. You know, there's been academic research behind this. There is all sorts of research. And anecdotally, we know that women are nurturers, caregivers, and we then tend to have less productive life, healthy life than the men. So I want to say to you that every aspect of your health and your wellness is important. And that today is the day that you take that action, that thing that has been niggling, that has been bothering you. Today is the day where you get up and go to that primary healthcare center, that clinic, speak to somebody in a pharmacist, and put yourself first. Your family will be fine, and they will be even better when you are healthy. So that's my charge for every woman, not just the menopausal women, but for every woman.
Okay, I'd like to tell someone out there that menopause is real. It's a part of every woman's life. It's not a form of sickness or disease. And I'd like to encourage you, just get knowledge. Knowledge. And that's one of the best way you can handle menopause. Get yourself involved in a lot of exercise, feed well, and engage yourself in self-care. Menopause is real and it is sweet. Is at this stage.
Fantastic. Thank you, ladies. This has been absolutely amazing. What I love is the collaborations that can come out of this, and also the community. I think what's really important is to keep talking, knowing that there are so many of us going through the same thing, not to go alone. And I'm looking forward to the World Menopause Day, your conference, and really collaborating with you and Dr. Simi on that.
Thank you very much. Thank you for the invite.
And that's a wrap. Thank you guys for watching. Keep being authentic. Thank you.